Now, another hurdle in the vaccine rollout is making sure everyone has access. One doctor in Miami is trying to make it easier for her city by bringing the vaccine to the neighborhoods hit hardest by the pandemic. Dr. Tina Carroll-Scott joins us now. She's the doctor behind this push for vaccine access and the medical director of the South Miami Children's Clinic. Dr. Carroll-Scott, good to have you with us. So you held a pop-up vaccination clinic last weekend with the goal of reaching Black and Hispanic families, two communities hit especially hard by the pandemic. Tell us more about how you made this clinic happen and how many people you were able to reach.
So one of the things that I've been concerned about from the very beginning of this pandemic was, being able to reach communities of color being disproportionately affected by this virus. Black and brown communities are being infected at 4 times the rate as everyone else and dying from this virus at 3 times the rate. And I was very concerned about the vaccine rollout in our state, one from an access standpoint, but then even in the communities where they did provide access with the vaccines, there were additional barriers where the residents of those communities, if they had an underlying health condition that would put them at risk for severe COVID disease, they had to now produce a medical vulnerability form signed by a physician in order to get vaccinated. And that just created additional barriers because people in these communities also tend to have issues with access to basic health care and don't have a medical home and would not have the ability to see a doctor to sign that form. So it just felt like there were so many people being left out of this process, even when we were, quote, providing access with the vaccines. So one of the things I wanted to do with my pop-up clinic was to eliminate those barriers that were disenfranchising many people in these communities and bring more people into the fold and get them vaccinated. And so that's what we did on Saturday. We had a pop-up clinic. We provided physicians on site who could do those health assessments and qualify patients with underlying health conditions such as obesity, high blood pressure, diabetes, and get them vaccinated. And we actually exceeded our goal. The target was 500 vaccines, and we actually ended up vaccinating 648 people. And there's still, even more desire for us to do another one of these because, people were just incredibly grateful for us not only bringing it to the community, but removing those barriers that they've experienced in other places.
What a great solution to a problem that maybe a lot of people don't think about. Now, you're doing more than just giving out the shot. You're also having to address vaccine hesitancy, misinformation, and just general mistrust about medicine, not just vaccines, but medicine. Yes. What's been your message about the importance of getting the vaccine?
So I'll talk specifically about the Black community. And one of the things that I started doing a few months ago, because I was concerned about a lot of the misinformation that's been on social media, but then also the history in the Black community with medical experimentation and exploitation. And so I wanted to make sure that we were addressing that before we did any sort of rollout, so that we would have a higher acceptance. So I actually did a lot of teaching at local Black churches in the area, educating people not only about the virus, but about the vaccine as well, and addressing any questions or concerns that they had. And, I think one of the things that, I told people is that we can't ignore the history. That's a fact. But we're in the middle of a raging pandemic that is affecting our communities disproportionately. And so we need to make sure that we are protecting ourselves, our families, and our communities. And, and letting them know that this vaccine is safe, that I trust the vaccine more than I trust this virus. And that's sort of the message that I'm giving to everyone.
That's a good message. I like to hear that one. Now, one more thing I want to ask you. More than 5 million Floridians have received at least their first dose. We know the majority come from Florida's older population because of the eligibility rules so far. Now, as more people become eligible for the vaccine, what do you want to see the state do to improve access and trust among communities of color?
If I'm going to be perfectly honest, I think that and communities of color that are being disproportionately affected, that we need to open this up completely. I think anyone who is eligible, 16 years and over, should get this vaccine. A lot of these families, they're multi-generational homes, and so vaccinating grandma and grandpa, but then having other family members who are younger that don't qualify at this point, I think just kind of defeats the purpose, and it makes everyone vulnerable. So I think for these particular communities that we need to eliminate any barriers whatsoever and completely open it up. I think, also, as I mentioned before, the education piece of it is going to be paramount. That's going to take your trusted messengers in these communities, myself included, physicians, pastors, local city leaders, to really get out there and to talk to people and meet them where they are and educate them. And I think when people are empowered and they understand their role, not only in protecting themselves, but their families and the community at large, that's when we're going to end this pandemic.
Dr. Tina Carroll-Scott, you are an inspiration. Thank you so much for everything you're doing and for joining us this morning.
Thank you very much.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.